East Asia, West Asia, and our third section will be a combination of Europe and Africa. So you are not going to want to miss these presentations. Here's the catch. If you have not registered yet for the Global Summit, we ask that you do that right now. Go to awr.org/health. In order to be a part of the upcoming 3 sessions, you need to have registered. So please go right now to awr.org/health and get your very special seat saved. There's only 500 seats and most of them are already taken. Well, now I am very excited to introduce my good friend, Dr. Peter Landless. Dr. Landless is the health director of the General Conference of Seventh-day Adventist World Church. He is also an adjunct professor of medicine at the University of Maryland in Maryland at the School of Medicine. He also is an adjunct professor at Loma Linda University School of Medicine and also Loma Linda University School of Public Health. Dr. Landless, thank you so much for joining us, and thank you for the input that you're going to provide.
Thank you so much, Dr. Lela. It is again a privilege and an honor to be here with this team on this Meta-sponsored, particularly important and topical meeting, this global meeting on COVID-19. And the responses that hospitals around the world have made in the Adventist health systems to this pandemic. We've heard so many times that this is an unprecedented time. And to help us just remember how unprecedented it is, because statistics sometimes become so frequently used that they begin to mean less and less to us. But as of this evening, over 23 million cases of COVID have been documented, which means that there are probably a lot more that have not been documented. There have been already there's been 806,000 deaths, close to 1 million. 188 countries and regions have been affected by COVID-19. And this is a huge issue and it's ongoing. What has happened during this time is that areas have been devastated, ravaged by this virus. Economies have been brought to their knees. Political tensions have been brought to the fore. Hospital systems have been overwhelmed. ICUs have been overfilled. Protective equipment has been in short supply. And we see this continually unfolding on a day-by-day basis. And then we think to ourselves, what is it that the Seventh-day Adventist Church has to say about this? Well, health is germane. It's actually, I like to say, it's in the DNA of our denomination, because right from the beginning of our existence in 1863, the church has had specific instruction and guidance on health, not only on health of the individuals, but health for communities, and also the importance of starting healthcare systems. And as a result of that, the Seventh-day Adventist Church is the largest Protestant faith-based organization of healthcare providers in the world today, with close to 450 hospitals, clinics, and dispensaries, serving millions of patients every day, and employing hundreds of thousands of people. But the most important thing that we do is to care for patients. That is why we exist. That is who we are. And of course, we don't do this alone. And all the people who are going to participate in this conference are those who are at the coalface, at the forefront. And we need to also remember that during this time, this is an evolving learning system that we're going through. We don't have a textbook already made on COVID-19. The textbook is being written. And so treatments are becoming known. Treatments are being tested. And we need to be cautious that we do not go from our platform of evidence-based medicine to opinion-based medicine. But that's going to be discussed in total as well, as much as possible. Then, of course, we have other partners. We have a robust partnership with the Adventist Development and Relief Organization, ADRA, and ADRA is robustly working in more than 70 countries in partnership with hospitals to make sure that we can do the work that needs to be done. We need to remember, at the core of all of this, it's people. It's the patient. This is why we are here. We look at what COVID has done. It's highlighted the issues of loneliness. It's highlighted the fact that people who get critically ill alone often die alone. And in many hospitals that I've seen that work in Adventist health systems, there are signs which say, heroes work here. So heroes are working in these hospitals, in these clinics, trying to help make the difference. I'd like to just close this introductory comment by saying, let's never forget that at the core of every effort, of every intention, of every hospital, of every health professional working on the COVID crisis is a patient. Let's not forget that, and let's work towards the answering of the prayer that we will, as a world team, reflect grace, excellence, and compassion as we truly try to extend the healing ministry of Jesus in a broken world. God bless you. I know this conference is going to be an amazing experience for all.
Wow, thank you so much, Dr. Landless. I always am impressed with the words of wisdom that come from you. So thank you so much. And thank you for leading our church in health ministry globally. Well, you know, as a Seventh-day Adventist church, we believe in holistic health, physical, mental, emotional, and spiritual healing. And it's broken down globally in different areas of the world. For example, we just heard from the general conference, the highest level, if you will, that looks kind of at the forest of our church for health. Well, within that, we have divisions of health, if you will, throughout the world. And since tonight is on the Americas, we are blessed to have Dr. Angeline Brauer to give us an input as far as North America is concerned. Dr. Angeline Brauer is the health director over North America. She also is an accomplished author. She is a nutritionist, a doctorate in public health, many years of experience. Dr. Angeline Brauer is also my personal friend, and I want to thank her for joining us. We look forward to what you have to say, Dr. Brauer.
Thank you so much, Dr. Lela. It is always a pleasure to work with you and to serve along with you. And Dr. Landless, thank you for your global leadership at this tenuous time in the world's history. And a very special thanks to the leadership and planning team of MEDUS for this global summit. Really such a need, and it's a privilege to be serving with you. Well, here in North America, as we know, there is certainly a great need to bring hope and healing to those who are suffering from the infectious pandemic of COVID-19. Many have lost loved ones and are left without even an opportunity to mourn them. And many who may even recover from COVID-19 still face a long road of recovery from those secondary illnesses. However, there are heightened concerns, not only due to COVID-19, but also to a plethora of issues that until now were perhaps stirring in isolated instances. We are facing a crisis of what I believe Jesus Christ referred to as men's hearts failing them for fear in Luke 21. The magnitude of the situation is indeed great and cannot and should not be ignored. We know that our medical workers are being worn out. We know that our teachers are afraid of their own health as schools plan to reopen. Even pastors and religious leaders are facing situations that are stretching them to their limits. Moreover, we are greatly concerned about the health and welfare of children who are living in unstable, unhealthy, and even critically unsafe conditions. Stress, tension, mental anguish, and burnout are being faced by all. What we can say with certainty is that healing is needed now more than ever. And it should be a priority for all of us now more than ever. Emotional healing, especially, is an area that we cannot neglect, even as we seek to heal the body from the effects of COVID-19. As Dr. Landless already shared with us, that our patients are people. These are men, women, and even children who have suffered not only physical turmoil through the virus, but they have also suffered emotional bruises, hurts, even abuses. And these are having injury placed upon injury. So along with the healing methods that we discussed tonight, let's not forget that what the world really needs is to understand a couple of things in my thinking. First, the world needs to realize that there is a God who loves them devotedly and who is promising healing to come at some point. But secondly, the understanding that they have about this God will come through their interactions with us, because the world needs to see that there are a group of people on this earth who are so devoted to this God that they can't help but have his love flow out of their own hearts to touch every life that they come in contact with. So as we consider the methods of healing that the Seventh-day Adventist Church can share about intelligently and passionately, let's not forget that the greatest need to the world are people who are reflections of Christ in word and action. Your patients will be immeasurably grateful for the healing that you administer to their bodies, but they will be eternally grateful for the healing that you minister to their hearts. And if I may add, that healing begins when healing happens in our own hearts. And that is my earnest prayer for each one of us, that in this conversation, we all will feel and experience that healing. Thank you so much, and blessings to each one of you.
Thank you so much, Dr. Brauer, and thank you for all the work that you do here in North America. You know, as we mentioned, the Seventh-day Adventist Church believes in holistic health: physical, mental, emotional, and spiritual healing. They're one beautiful big circle. And that is why we are so excited to invite my boss, Dr. Duane Mckey. I have the privilege and blessing of working as the medical director of Adventist World Radio, and Dr. Duane Mckey is the president of AWR. Dr. Mckey, of course, you are the co-sponsor of this event, and we look forward to your comments and your prayer as we lead out in spiritual healing to this conference.
Thank you, Dr. Lela, and we are so excited to have you as on our team as our medical director and also working in the pathway to health. It's thrilling to see what is happening around the world. What an opportunity and what a time to be alive, as now, because of the COVID, we're able to do a lot more via Zoom, touching a lot more lives than we ever have before. And we just pray that God will continue to bless, but also we pray for those who are hurting. As Dr. Landless said, all the people around the world that are sick and hurting, and as Dr. Brauer said, the children as well. We want to pray for each one. And we want to pray for this symposium, that God's name in the end will be uplifted and people would turn their hearts toward home, toward Jesus. Should we pray together? Father in heaven, I thank you. I thank you for your love. I thank you that we have the symposium. I thank you for Dr. Lela and Dr. Peter Landless and Dr. Hart and Dr. Brauer and all the rest of the physicians and Meta. And we just pray that you will bless each day, each hour, as we go through this around the world. What an opportunity to share Jesus, to share hope, as people are living in very difficult times. They're living, they're afraid, they're wearing masks, and they're isolated, they're sequestered. And I just pray that you will comfort them, help each one to know how much you love them, and help them to know that Jesus is preparing a home for each one of us, and he's coming soon. In Christ's name I pray. Amen.
Amen. Thank you so much, Dr. Duane. We really appreciate everything that AWR is doing. You know, I am so excited about how this medical summit, this, again, Adventist COVID-19 Global Medical Summit, is going to proceed. And I want to share with you how the overall plan will go. Right now, we will be having our first of 2 medical presentations, between which there'll be a panel of doctors and specialists throughout of Americas. So we'll have North America, Central America, and South America. So stay tuned. And if you haven't yet shared the link, please share the link with your friends and family, because tonight is going to be something very special. Again, if you haven't yet registered for the next 3 upcoming sessions, go to awr.org/health and please get registered so your seat can be saved. What I'm excited to share with you right now is regarding my alma mater, Loma Linda University Health. When we set out to have this summit, this global summit on COVID-19, we came up with 3 objectives. The first is we want to look at how different countries have been dealing with COVID-19. But we wanted to look at it specifically from a Seventh-day Adventist perspective. We wanted to investigate how this church hospital system has been dealing globally with COVID-19. So we're looking specifically at those lifestyle principles that the Seventh-day Adventist Church has dealt with and investigated for over 160 years. And then we want to bring in the spiritual aspect of health, not just physical, not just mental, but the spiritual aspect, to find out how our Adventist hospitals and medical centers and physicians have been able to share the love of Christ at a time when things are quite stressful. Well, I am very excited to introduce my mentor. In fact, I have told thousands of people, if I could be 1 ounce of Dr. Richard Hart, I will have succeeded. Dr. Hart is the CEO and president of Loma Linda University Health. He's an internal medicine specialist, worldwide, global renowned, and again, a good friend of myself. And I also want to introduce Dr. Adrian Cotton. Dr. Cotton is the Chief of Medical Operations at Loma Linda University Health, and he is also an internal medicine specialist. So, gentlemen, we are looking forward to hearing from you as to how the United States Adventist healthcare, if you will, has dealt with COVID-19, and specifically Loma Linda. Thank you, Dr. Hart and Dr. Cotton.
Thank you, Lela. It's a privilege to be with you and to take part in this. Kudos to AWR and Lela and Metis and others for putting this together. And I appreciate having my colleague Adrian along. What I'd like to do is talk a little bit about the history of COVID, how we got to where we are in this country, and then ask Adrian to talk a little bit about its particular impact on Loma Linda and how we've dealt with it here. If we go back just a few months now, back into January, February, we started hearing about a disease in Wuhan, China, that at first no one was too concerned about. We had heard diseases before, no one was following too much. And then all of a sudden we heard about an outbreak up in Seattle area. I can remember very distinctly first as well, we know where this case came from because they had contact with that traveler and that was where they were exposed. But then within a week or so, then what we called community contact started coming up, meaning we don't know where you got the infection. It came from somebody that you must have been in contact with. And it was at that point, I think, that COVID moved into the fear stage of, oh my goodness, this thing that we can't see, that we can't understand, we don't know how it's traveling, but now it's exposing all of us to the potential dangers. That COVID then moved on down through this country. Cruise ships started getting infected, and all the dangers that came out of it started pushing across the U.S. I think as history looks back on this, it will be impossible to separate politics from COVID. Because in our country, it came at the time when we were entering into a political campaign for a new president. And that compounded all the discussion that took place in the U.S. And in other countries as well. It was clear to see those political leaders who wanted to confront this head on with medical science and those who tended to want to ignore the medical science and move forward without it. So in our situation, there was a fair amount of denial initially in terms of what was happening, how it could spread, and the fear that we may have. And then, as you know, history hit New York. And in retrospect, those cases probably came from Europe, not from China, and started infecting New York to a great degree. And within a month or so, the New York hospitals were being overwhelmed. We were still uncertain of how this was spreading. But what became clear is the techniques, the models that we had for controlling it were not adequate. Pretty soon, the personal protective equipment, PPEs that people needed in hospitals and elsewhere were not sufficient, were not available. The testing was not available. And all the sorts of things that compounded this disease around the world became a very complicated factor in trying to deal with it. As the months have gone by, the disease has moved across this country in stages, hitting various parts of it heavily and then spreading into new areas. We're now faced with a whole new issue of whether children should go back to school in the fall. Here at Loma Linda, we've decided to open up our school, but with all the social distancing, mask wearing, and all the other precautions necessary to protect students from exposure. We are a health sciences university, so we believe it's important for our students to be able to understand how to protect themselves from these kind of settings. So we believe it's not only appropriate to protect yourself, but also to have good experience in how to protect and shield others. Where will this go next? As I sit in my position here at Loma Linda, we're also relating to through Adventist Health International with hospitals around the world. And it's been fascinating for me to watch the different responses in different parts of the world. There's a fear, great fear in Africa that indeed our health systems, both the government and private health systems, are simply not adequate to deal with all the complexity of cases. There's some slightly good news from Africa is that indeed the widespread use of BCG vaccine for tuberculosis prevention may somehow give somewhat of a protective factor through T-cell mediated immunity that would give some protection. And of course, the drug hydroxychloroquine that's much debated and probably not effective as a treatment modality for COVID, but is widely used throughout Africa to control malaria and treat malaria. And perhaps through that modality, it can have some impact as well. So Africa seems to have been somewhat protected to date compared to what we're afraid of. Latin America, South America is hitting the full brunt of this now, particularly in some countries down there. Asia has done some pretty good job of protecting it in many countries. Certainly China, Korea, South Korea, Singapore, some other countries there have done quite well. Canada to the north of us has done an exceptional job of being able to control the disease. So as we watch around the world, we're getting a quick lesson in the epidemiology of COVID, what this means, what it can do. Unfortunately, the US has not provided the example that we should have. Because of our political involvement, we've not been able to provide the leadership and control measures that I think we should often are looked at to do, and we've been ineffective in trying to do that. We also are struggling to deal with the testing issues. Now, of course, the testing is getting divided into the RCP testing that is trying to look at whether you currently have an infection and then looking for antibodies, whether you've had an infection in the past. The questions are still open, how long those antibodies will last, how effective are they in protecting against the disease, how long will the antibodies from the disease itself, if you've been infected, last. Does, in fact, plasma from people infected, is it really that effective? These are so many scientific questions that we don't know the answer to yet. And of course, one of the biggest questions is the vaccine. When will it be ready? How effective will it be? There's many different forms of vaccines being developed now by different organizations here in the US and in Europe and elsewhere. We hope they'll be effective. We don't know how soon they're coming out. Russia, of course, has announced their vaccine is ready. In the US, we think we'll have a vaccine by the end of the year. There's some hope perhaps it may be by the end of November. But how effective it will be, how widespread we can produce it, who will get the first ones, I can already anticipate some political furor over who gets the privilege of being immunized and who doesn't. How rapidly can we produce vaccines, and where will this go? So those are many of the questions that we are certainly facing here in this country. And I'd like to turn now to Dr. Cotton. Dr. Cotton is Chief of Medical Operations here at Loma Linda. and had a firsthand view watching how Loma Linda was able to respond. We were fortunate in being able to plan adequately for PPE, so we've not had a real shortage of that. But we started off initially with a clearing out the hospital, waiting for COVID patients that didn't come. And then over the last month to 6 weeks, we've had a real surge of COVID patients. So Adrian, let me turn to you to talk a little bit about Loma Linda's experience, and then we'll dialogue a bit in terms of the future.
Thank you, Dr. Hart, and thank you, Dr. Lewis and Dr. Landless, and everyone else on the team for inviting us to have this opportunity to talk. Our experience goes back actually to early January when we first started hearing a little bit about this disease, and we actually set up a meeting that we had once a week at that point, where we would get together and discuss, things that we thought might be coming with this, things that other countries were finding out, and we were starting our planning as to what we would do if and or when COVID hit. One of the comments that we made early on is anything we know about COVID will probably be different about 5 minutes after we've either talked about it or said something about it. And as you're all aware, we found that to be very, very true. So we had a weekly meeting with the infection control people, myself, Dr. Dorota, who's our chief of patient safety. And again, we started planning in early January for this. Those meetings then went to about twice a week as February came around. And then March is when things kind of really got interesting here, where we started to see some people coming in with a disease that we hadn't seen before. We were seeing this in our ICUs and our basic floors. And then we actually started, we set up what we called a command center, which I think was incredibly valuable for us. And it got all the parties on campus. So not just our hospital, but our university as well, and all the different schools. We got together on a daily basis, and for probably 4 or 5 weeks in there, even twice a day. And we would get together, we would start with prayer. We put up our favorite text, which Dr. Landless knows well, which is Galatians 6:9. Let us not become weary for doing good, for at the proper time we will reap a harvest if we do not give up. This is a Bible verse that we've used in our patient safety and reliability and our quality network for the last couple of years here at Loma Linda. And I think it helps us reset ourselves every morning and every time we meet on what we are doing. As Dr. Lewis said earlier and Dr. Landless said earlier, this is all about the patient and being able to take care of the patient. However, with that, we also have to take care of the team that takes care of the patient. Take care of the doctors, the nurses, the respiratory therapists, the janitorial staff. The number of people is too many to count that we needed to take care of. As Dr. Hart alluded to, PPE has been an issue across the country. We had Josh London, our central service supply, and he got on very early in ordering different PPE that we thought we might need. And so we never got to the point where we actually had to reuse N95 masks. Now, we have a bunch that we sterilized and we have stored away, but we didn't actually have to reuse any of them. Dr. Thomas in the School of Medicine led out in some conferences calls that we would do for the doctors. We probably did 3 of them, giving them updates on things that have changed, how we're doing things differently. As Dr. Hart alluded to, testing was a very big issue. And at the beginning, there was no good testing across the country or here at Loma Linda. Dr. Herman in our lab was doing yeoman's work to get us the right testing that we could and how we could and as we could. And now, fortunately for us here at the Loma Linda, testing is no longer that much of an issue. We're able to test who we need and how we need and when we need, which is very, very fortunate. So early on when this started, the Surgeon General recommended that we shut down doing elective surgeries. And so we actually started that in early March. We had gotten together and came up with a 8-phase program of how we would close different units and expand the acute care, and close different ICUs and expand the ICUs, and where we would put patients and who we would have taking care of those patients. And then, as most of you experienced, at least in North America, March came around and no patients came. Our main hospital campus usually has a census of around 300 to 310 patients. We dropped down to a census of 159 patients. we had about 20 patients that had COVID. And at the beginning, none of them particularly sick. Now that's changed. Quite a few of them have ended up in the ICU. And if you look at our overall experience now at Loma Linda, we've probably treated somewhere in the range of 750 to 800 patients, of which probably around 75 of those have passed away, of which probably 60 to 65 of those we would say passed away because of COVID, and the other 10 or 15 passed away with COVID. So back in March, again, we kind of shut everything down like we were asked to, and the state requested that we did. And patients didn't come, and after a certain length of time, we started reopening and bringing other patients back in and started doing surgeries again. Things were kind of stable. We were running between 15 and 20 patients for probably about 6 weeks or so. And then kind of mid to late May and early June, we started to see a surge in the number of patients we had. We actually peaked out at 79 patients. It was about 3 weeks ago or so, maybe 4 weeks ago now. We had actually even shut down our command center, and we reinstated the command center, but we did it virtually this time. And so, again, before we had a physical command center that people called into. This time and as we phased that out, we set it up as a virtual command center. When we came back in, we started it again as a virtual command center with daily calls, again, as needed. And now we're down to once a week again. As of today, actually as of about 2 hours ago, the census of COVID positive patients at our main campus is 39. We're back under 40. When we're under 60, we can handle this very easily. Things go pretty smoothly. So the other part of that is on our campus, we obviously have a university as well, and an awful lot of employees that we need to take care of. Dr. April Wilson, who's in charge of our employee health service and student health service, got very involved very early on in coming up with protocols, reading the information from the CDC, coming up with protocols that will help both our schools reopen, take good care of our students and our employees. And we're fortunate to say that if you look at the rate of our employees that have tested positive compared to the rates in the local community, what our county is currently reporting is around a 13.5% positive rate on people that have been tested. Our employees here at the hospital has been around 4.5%, so significantly better. And we put that down to a few things. One is proper PPE and wearing of equipment, and two is taking care of ourselves as much as we can as well. I did kind of take, this dream is going to turn out to be an epidemiologist dream disease, because the amount of information that we will gain from this and glean from this in the future is going to be quite incredible. Of course, it doesn't help us right at this moment, but the future will give us significant amounts of information. You've probably all seen the dashboards that have gone around. Different counties have them, different states have them. Johns Hopkins has been famous for having one. The nice thing about that is this is data that's all put in a dashboard that's created by a company that's about 8 miles down the street from us called Esri in Redlands. And they're the ones that have been able to help graphically describe this, and also working on gaining more data so that information can go out to all of us, which has been incredibly helpful. In regards to the different treatments that we have looked at, we have started an IRB-approved trial for convalescent plasma. We talked with the company Gilead early on to try to get on the compassionate use for the medication remdesivir. We had our rheumatologists and our infectious disease doctors get together and come up with some protocols that they looked at using autoimmune modulators. We looked at hydroxychloroquine early on. And now the interesting thing about all of these treatments is, at this point, we actually don't know if any of them actually make any difference or make any additional benefit. We think they do, but we're not sure. Dr. Landless and Dr. Hart both alluded to it earlier, is there's a lot of emotional things going on with treatment and therapies, and there's not a lot of good science or data yet. Hopefully we will get to that point. Currently our ICUs are down to about 15 or 18 patients. Our regular floor is down to about 20 patients today. Our children's hospital, which actually is a separate facility, They've had very few children that have gotten this illness and have had no deaths of children because of COVID. We have had one 17-year-old pass away that was COVID positive. However, they died of heat stroke. The COVID was an incidental finding. In our children's hospital, most of the positive patients have actually been our OB patients that have come in. And we have had a few of those patients that have ended up in the ICU. Fortunately, all her moms so far have survived, which is good. Now, I did a chart review probably about 3 weeks ago, a very quick chart review, looking at our patients, was when we had about 75 of them in the hospital. And was just looking at one very interesting factor, and that's body mass index, of which body mass index can be used as an indirect determinant of what someone's health is like. And that day that we had 75 patients in the hospital, we had 5 of them that had a body mass index that was less than 25. We had another 5 that had a body mass index between 25 and 30. We had 65 that had a body mass index over 30. The majority of those had a body mass index over 40. Now, I don't think obesity makes you get COVID more than any other disease state, but I do think if you are obese and you get COVID, you are going to have a harder time and more complications with it. The majority of our patients on the ventilator were overweight as well. Dr. Hart, you're on mute somehow.
I think our time is running out, so thank you very much for sharing that history here at Loma Linda. As Lela said, the obesity issue appears to be a real factor. So I think that's one thing that a vegetarian diet and regular exercise has protected this church from to a considerable degree. And through that and other measures, I think we do have some protection against COVID. So thank you all. It's been a privilege to be with all of you, and I wish you well in the rest of the program.
Thank you so much,
Lela?
Dr. Hart and Dr. Adrian. I just want to say before you guys go that Loma Linda University is my alma mater. I love Loma Linda with all of my heart. I trained there as an OBGYN, both for medical school and residency. And I can attest to what you're saying, Dr. Adrian. It was a little scary. I live here in Arizona, and a few months ago, we hit our peak, and we did not have PPE, as I talked to Dr. Hart about. I was reusing my N95s. I was sterilizing them at home myself. I had no boots left in my OBGYN department, and I actually bought water galoshes to get through the OR. So I am grateful to God that things have now stabilized here in Arizona, but around the world, I am looking forward to hearing what some of our other medical professionals have been dealing with. And as you said, Dr. Hart, there's a lot of lifestyle measures that we as Seventh-day Adventists and Loma Linda has taught us that, if employed, I believe can help to optimize our immunity. So thank you again, Dr. Hart and Dr. Adrian, and thank you, Loma Linda, for all that you have done in training so many of us in holistic health. Thank you. Well,
Thank you.
Now we are going to go to our panel. And as we mentioned at the beginning, I know there have been a lot of you that have joined on as we've continued. And our objectives, we have 3 objectives. Number 1, to talk about the current COVID-19 situation in various countries around the world. And tonight we're looking at the Americas. We've heard how the United States has been dealing with COVID-19. We want to hear from Inter-America and South America and various countries in those locations. But we also want to delve deeper. Seventh-day Adventists, again, believe in whole person healing. For those of you who've had the opportunity of joining us on Level Up, we have been looking at these holistic aspects of health for the last several months, looking at everything from, we use an acronym called Want Rest. There's many of them out there, but water, fresh air, proper nutrition, like Dr. Hart mentioned, and it's protection, if you will, against obesity or high BMI. Temperance, using moderately those things that are good for us and avoiding those things that are harmful. Adequate rest, good sleep, exercise, getting adequate sunshine. Vitamin D has been shown time and time again to be protective against COVID-19. And most importantly, trusting in God. And so right now, we want to take objective number 1, again, looking at the statistics of COVID-19 in various countries, but we want to take those principles of health that Seventh-day Adventists have been teaching for 160 plus years. And we want to look at them in relation to COVID-19 and our Adventist hospitals and networks around the world. Finally, we want to take those lifestyle principles that we just talked about and ask the question, how have we been employing these principles of health that we know? How has that resulted in holistic health to the community around us? How has that brought not just physical and mental healing, but spiritual healing to those in need? So I am very excited to welcome our first panelist, Dr. Zeno Charles-Marcel. Dr. Zeno is a very good friend of mine. I talk to Dr. Zeno quite regularly. He is an adjunct professor at my alma mater, Dr. Loma Linda University Health of Internal Medicine. He is also the Associate Director of Health at the General Conference of Seventh-day Adventists. Dr. Zeno, can you tell us a little bit about, we've heard about the statistics as far as the United States is concerned. Can you tell us the COVID-19 statistics in relation to not just to the United States, but to the rest of North America, Inter-America, and even South America? Dr. Zeno.
Yes. It seems as though my mic is giving a little trouble. Anyway, can you hear me all right? Okay, good. Thank you very much, and thank you for having me on the program. Well, as of the 23rd, we've had some interesting changes that have occurred in the Inter-American region, that is Latin America, North America, from all the way up to, from Canada all the way down to Argentina and Patagonia. Well, worldwide, we've had 23 million cases, more or less, and 11.5 million of those cases actually are in the Americas, right? Of the almost 1 million deaths that we've had worldwide, over 400,000 of those have occurred in our area. So that basically we have in this region the highest burden of COVID-19 to date. Okay, about 55% of new cases in the last week were reported from this region, even though 13% of the world's population reside here. 64% of the officially reported cases so far come from here. So now, what are the countries that are most prominently affected? The United States leads the list, not just here, but worldwide, with 5.6 plus million cases. Brazil comes in with over 3.5 million cases. And then we have 3 countries that are all over 500,000 cases, which would be Peru and Mexico and even Colombia, okay, in that range. Okay. We've also noticed that some countries that have been stable before are now having more cases. Peru is one of those. The Dominican Republic is another, and in the other parts of the English-speaking Caribbean, Jamaica and Trinidad and Tobago. But there have also been an increase over the last few days in Turks and Caicos, also in Guadeloupe and Martinique and the British Virgin Islands. So it's spreading around in this area. The idea of just physical problems associated with COVID, though, is maybe misleading. Fear and anxiety and grief and uncertainty is actually gripping people in all of these countries. PAHO had a recent report talking about this as a major problem. So we have the pandemic of COVID, but we also have an epidemic in this region of mental issues and domestic violence. This is part of the problem. We have additionally a lot of news mongering, if you will, and misinformation. This causes a lot of distress in people who may be affected or those who are just afraid of becoming affected by COVID-19. But we also have the issue of the comorbidities, people who have prior conditions to the COVID-19 epidemic. We have a disruption, if you will, of regular health services. So people with comorbidities actually may not have the same access and the same kind of treatment that they were using before. And this actually begs the question to the degree of self-care and self-monitoring and actually empowerment of individuals in their own care, even before COVID-19, and now certainly during the time of COVID-19. So some have described this in Latin America and in the Caribbean and even in North America, even though Canada has been somewhat spared by much of this, only about, well, much less affected than the other countries in the region. And this perfect storm shows that we have increased needs and we have limited resources. We have these corresponding comorbidities, and we have depression and anxiety and an increased use of alcohol and drugs and the underlying conditions. So this brings us to the point of how people were living before COVID. Their social, economic, cultural basis, and the underlying diseases or conditions that they may have had. And then this is exacerbated by this virus. The virus is opportunistic in a sense. It will find our weakness and it will go after it, so to speak. So how we live under the circumstances now and how we lived before will affect some of our susceptibility and whether if we're going to get the disease, how severe it will be. So what we eat, how much we eat, even when we eat may play a part. The physical activity, how much, what type, whether we're regular exercises or have regular physical activity or not, whether we have outdoor activity and sunshine, and whether we have enough vitamin D in our exposure and in our diet, whether we get enough sleep, adequate amounts of sleep, and of course the issue of stress. Stress is a big one, and COVID-19 actually exploits the problem with stress. If we add the mental illnesses and so on with that, which was underlying in the first place, we also have the problem of the stress of stigmatization and the decrease in the availability of services. So we really have quite a bit of a problem here. I wish I were giving you some good news, but this happens to be a snapshot of what's going on right now. You're muted.
Thank you. Thank you so much, Dr. Zeno. I apologize for that. Now we are going to hear from Dr. Jaziel Jimenez. Dr. Jaziel is a microbiologist, a pulmonologist from the Universidad de Montemorelos. He's also the chief of COVID-19 at the General Hospital in Montemorelos. Dr. Jaziel, thank you for joining us. And Dr. Jaziel, you're muted. If you can unmute your device, it would be great. So we have a question for you, sir. What is the current approach of Mexico and the Universidad de Montemorelos to COVID-19? How have you been approaching it there in your country?
Thank you for the invitation, Dr. Lela. In Mexico, as I think in all countries, there is a great diversity between regions and leadership. But in general, in Mexico, since the beginning of the COVID pandemic, the strategy was the sentinel epidemiological surveillance, because we don't have enough resources to make the test as the World Health Organization recommended. So it's impossible to identify all the infected in order to isolate them. So the focus has been the recommendations of social distancing, hand hygiene, and use of masks, which in the last week has been strengthened. We don't have strict quarantines. The people go to work. We don't have strict quarantines. So we have a very prolonged epidemiological curve. Since May, we have a lot of patients every day. But in special, the mortality or the high mortality is in the obese people, or with chronic diseases very related to obesity. And in Mexico, very recently, we are maybe the second country in the world with obese people. So we have a lot of disease in this particular person. So in the last weeks, I would like to highlight a public policy in the importance of food. In one state of Mexico, there is is prohibited to sell junk food or soft drinks to minors.
Wow.
And this is in the state of Oaxaca. And this is spreading in the country, despite the opposition of big companies of processed food. And I hope this is the permanent approach in our country that we as Seventh-day Adventists, we must promote. And in Montemorelos, as you know, we have the University of Montemorelos, and we try to promote this, the health through good alimentation, good food, exercise, all the things that we need to promote. So the approach in Mexico is changing because of that, because of the obese is the pandemic in our country as well. So this is the most important thing in our country, because we don't have remdesivir, we don't have another drugs. Plasma, as been saying, is not working that well. So we need to prevent.
Dr. Hazael, I really appreciate what you had to say. That is phenomenal. And I just want to say that we are praying for our Universidad de Montemorelos. I have a number of friends that have gone to Montemorelos, and you have a wonderful institution. Thank you for emphasizing holistic healing and health. And I hear a theme. We hear it in America, we hear it now in Mexico, that obesity is really a risk factor for so many diseases, not just COVID-19. If we had many hours, we could talk about all the other risk factors associated with overeating. And we will take that time on future Level Up programs, so definitely stay tuned. Well, we want to come back to Dr. Zeno Charles-Marcel and ask another question. Just a very short question, but the specifics on epidemiology. You know, here in the United States, and we've heard it globally, that there are certain groups of people that tend to have higher rates of COVID-19. We've heard of different ethnic backgrounds, socioeconomic backgrounds, and I dare say even gender. Dr. Zeno, could you briefly tell us just a little bit about epidemiology in the Americas in regard to COVID-19? And you're muted, sir.
Thank you, and I will be brief. If we look at age, the peak age is between 30 and 39 for the number of cases. But if you look at deaths, the curve is curvilinear, and it goes up by decade. So it's very small in the children, and it's at the highest peak in the 70 plus age group. If we look at gender, males are affected greater than females, not by a huge amount, but it's a significant amount. If we look at hospitalizations, 81% of people who have the disease in Latin America and in the Americas in general actually don't need to be hospitalized, whereas 19% will be hospitalized. Of those that are hospitalized, of course, some of them will need to be in the intensive care. If we look at the whole group of people, only 3% of people will need intensive care treatment, and only 2% will need to be ventilated. So that's kind of a gross picture. But when we look at those who are ventilated and those who are in the ICU and those who need to be hospitalized, we find that ethnic background and socioeconomic status and some of the social issues come into play. So for comorbidities, we're looking at 5% of the individuals who need to be hospitalized Is that my mic?
No problem. We can hear you. No problem.
Okay. So if we look at the underlying issues, BMI is a major issue, and we believe that a major relationship with BMI has to do with inflammation and oxidative stress. Okay, so we have hypothetical mechanisms by which this would work, right? This is active, and many of the lifestyle issues actually may work through oxidative stress and inflammation. So in the ICU, 60% of people in the ICU will have diabetes. Okay, 30% have cardiac disease, 3% have renal disease, another 5% have lung disease, and those numbers are even worse when we look at the people who will need to be ventilated, and therefore the people who end up dying. So basically, if we can control the oxidative stress and the inflammation through how we live and what we do and how we do it, this would be a very powerful potential mitigator of COVID-19.
Thank you, Dr. Zeno. And again, for those of you who have not had an opportunity to hear in much greater detail, I want to again refer you to awr.org/health for two reasons. Number one, register for the upcoming 3 shows on the Global Summit, but also to get information on previous Level Up programs where we address these subjects in much greater detail. Well, now we're very excited to welcome Dr. Frank Genius. Dr. Genius is he's from the Adventist de Haiti, and he's the Associate Director of Health Services for the Inter-American Division. Welcome, Dr. Genius. Thank you so much for joining us. And you're muted.
Thank you so very much for having me in this program.
Thank you, sir. So we have heard the immediate direct effects of COVID-19, the primary issue being medical. But there are some indirect effects of COVID-19, and one of those is the effect that it had on our financial ability, our economics of our country. And we want to ask you, Dr. Genius, if you could address that specifically in regard to Inter-America and Haiti in specific.
Yeah, certainly it's going to be quite early to actually have a report of what are the outcomes of the COVID-19 altogether in the Inter-American countries. I want here to pinpoint mainly the country I know best, my country, Haiti. We all know that this is the poorest country in America and one of the poorest countries in the world. COVID-19 finds the country in a state of political unrest, of difficulties all around, which means that even before COVID, the economic situation was very, very, very bad. In March 19, when the outbreak of the epidemic was declared in Haiti, it was very quickly said by the president that the country is entering in a state of emergency. And because of the state of emergency, the country was shut down for over 3 months. And because of the shutdown, the economic situation, the economic activities was slowed down. Although in our country, we did not have as such what we can call a confinement. But still, we had the impact. And this impact was measured and established by the World Bank. And the World Bank considered that in Haiti, the contraction of the epidemic is making the country poorer than last year, the economic situation. But to give you an idea, estimated that another 1 million people will enter in food insecurity in this country by the end of this year. Just for you to know that already 3.1 million people was estimated by the World Food Program as in a situation, a state of insecurity, food insecurity. So which means that this is a very, very, very difficult situation. And this very difficult situation also is not matching with the number of cases that we have very low cases. We have about 8,000 people and less than 200 people so far in terms of casualties. So it is difficult. In the Adventist community, what we try to do, and now I'm talking about the entire community. In churches, we had food kit delivered since, I believe, since April many churches, although the churches was closed very, very early, but many churches were started to dispense food kit and what they call COVID kit. But at the national level, via ADRA, the Haitian Union started several projects, but one of which is a project to actually provide direct transfer of funds to over 2.6 thousand families. So this was their response, but you can imagine that this response was not enough. I am hoping that later on we can talk about some aspect of this, because this economic aspect trigger many other aspects, including the mental health, which I believe I will be having the opportunity to talk later on.
Wow, thank you so much, Dr. Genius. That is amazing. Yes. And I think it's important to think about the indirect effects of any time we encounter a major illness, and in our case, a pandemic. I am very excited now to continue this quest of looking at indirect effects of COVID-19. And one that Dr. Genius mentioned to or alluded to is mental health. And we have with us here tonight Dr. Neil Nedley. Dr. Neil Nedley is an internal medicine specialist. He's the president of Weimar Institute, well known within the lifestyle community, has spoken and written numerous books. Dr. Nedley, thank you for joining us. And could you address the question of indirect effects of COVID-19, particularly on mental health within the United States, if you will?
Yes, this has been very significant, Lela. JAMA Internal Medicine actually published an article on the mental health consequences of COVID-19, and it was amazing to see the marked effects that it's had. It shows that an large surge in post-traumatic stress disorder, large surge in alcohol use, depression and anxiety rates, which were already high, skyrocketing, behavioral disorders also going up, domestic violence going up, and child abuse going up. And part of this is actually due to what we're doing to try to protect ourselves from COVID, something called social distancing. I don't really like that term, because even before sin came into the world, God said it is not good for man to be alone. I like the term physical distancing much more than social distancing. And we can be physically distant somewhat and still have good social relations. But it's not just JAMA Internal Medicine that has documented this. In LA, calls for suicide, the suicide hotline went up 8,000% when the COVID crisis broke in February and March. 22 calls a month to 1,800 calls in just 1 month. LA and Orange counties in particular, dramatic rise in suicide risk and also suicides. Kaiser Family Foundation poll found that almost half of Americans report the novel coronavirus to have harmed their mental health. And a recent Gallup poll showed the same thing. Americans' mental health is suffering more than physical or even financial health due to the coronavirus.
Wow.
Emotional well-being is being attacked at a stronger rate than ever before in history. And this is largely being neglected by the COVID followers.
Wow, Dr. Nedley, and if we had more time, I just want to refer people to your institute for more information on ways that they can improve their mental health. You guys have done a tremendous job there at Weimar Institute. So I just definitely want to refer people there. And Weimar, if you want to tell us that website where people could go for more information, that would be great.
Yes, well, of course, there's weimar.edu, and also the programs for mental health are actually run by Nedley Health, and that is where we do our residential programs, and also we have online programs available as well for those that can't come here.
Thank you so much, Dr. Nedley, and I do definitely value your programs there at Weimar. So we've talked about the indirect effects of COVID. We've obviously talked about the primary direct effects of COVID. But what we want to know is, what can we do about it? I mean, so far we've heard a lot of I dare say, a little bit of negative information. We want some positive information. What have we as Seventh-day Adventist institutions and physicians done globally to help with COVID? Well, we heard some of that with our Loma Linda partners, but we want to hear some things that are happening outside of the United States. I am very excited to welcome Dr. Milton Mesa. Dr. Mesa is the president of Universidad Adventista del Plata. I apologize, the dean of the School of Medicine there. He has his master's in public health and an amazing, accomplished physician. Dr. Mesa, tell us a little bit about what your young people, your medical students, did there during the height of this problem with COVID-19 there in Argentina.
Dr. Lela, thank you for the invitation. It's a pleasure to be with you. And actually, we asked ourselves, what can medical students do aside from trying to adapt with the personal protection equipment that they would need and do the clinical rotations that actually are now stopped in Argentina as the cases still rise in our winter. So what can they do in order to combine help from the health perspective that we have as a church, as physicians, and at the same time to share a message of hope? So what we did is we partnered with the government, with the public health system of the government, to involve our students in the telemedicine program the government had for primary health care level. So one of the things we noticed is that people stopped checking, doing the checkups, those with chronic diseases, with non-communicable diseases, hypertension, type 2 diabetes, obesity, as we heard now. So what we did is we offered the government that our students could do a training on lifestyle counseling for physicians, nurses, and healthcare personnel from those centers who had to do the telemedicine checkups or follow-up of those patients. And on the other hand, once they were trained, we partner our students with those physicians to have families with people with chronic diseases assigned to each of our students to do the follow-ups in a longer term. That gave us an opportunity to enter their homes and to care for them, giving the type of lifestyle, evidence-based lifestyle counseling that we actually well know as a church. But you probably would be amazed to see what lack of opportunities and knowledge people have about simple things that they can do that we know well. 8 natural remedies in this case, as simple as that, and having hope that God can have a part in this, where we were able to get so many feedback, wonderful stories that we don't have time to share now, but it has been amazing to see our students involved. You know that they want to interact with patients, and we have seen a success story in this sense with this partnership with the government.
Wow, Dr. Milton, I look forward to bringing you back and having you on a future Level Up program and hear more of these amazing miracle stories. I know here in the United States, our medical students have kind of had their hands tied in some locations, but thank you so much for taking these lifestyle principles that actually are now being shown in many cases to benefit, optimize the immunity specifically for COVID-19. Thank you for teaching our young people that, and thank you for utilizing that in the community around us. Well, we want to come back to Dr. Genius. Dr. Frank Genius from Haiti. He mentioned he would like to discuss, and we want to hear, how is the effect on mental health playing a role there in Haiti? We heard the effect that it's had here in the United States from Dr. Nedley, but how is it playing a role there in Haiti? And you're muted, sir. Thank you so much. If you could unmute yourself.
I'm very sorry about that.
No problem.
I'm very sorry about that.
No problem.
So as I told you, the outcomes of the epidemic in Haiti was very, I would say, paradoxal. And this is also the same reality for mental health, because what we witnessed here in Haiti is a situation where we had some sort of a different reality between Haitian living in Haiti and Haitian living in North America. As you might know, a large population of Haiti is living in North America between the US and the Canada. And
Right.
The very, very funny part of it was in country we had a situation where people was, cautious about the disease, but not the same level of anxiety compared to Asian living in the North America, because in North America you have a lot of cases, significant amount of casualty among the Asian population in North America as well, etc. So you had this discrepancy that created things that are very, very interesting, and to the extent that we had many people coming from America, coming back to Haiti. That was fairly strange, because this is something very different, very, very new in our recent history. But this created a new paradigm, a paradigm in the health system in Haiti when it comes to mental health. The first thing is, what we can say is that this renewed the interest of the health authorities about mental health. Mental health in Haiti and in many countries, I would say, was not considered as a very important subject, but right now it's gaining momentum. It's gaining momentum from one side. That's one thing that's happened. This is a positive outcome, as a matter of fact. And the second paradigm is that we realize that with the very poor infrastructure for mental health in Haiti, we needed to find out innovative way to address the very need of the people. Although I said that the level of anxiety in Haiti was less than people living outside the country, but it is true that the people was afraid of the sickness, of the disease, but beyond that, afraid of his brothers, of his sisters, of people living in the same house, the same campus, and the same churches, and the workplace, etc. So it was a very silly situation where people are afraid of giving handshakes, etc. So we are not very much accustomed to that, and this created situation that is very, very detrimental for the mental status of people. So we figured that we needed to implement some activities, and we choose to go for massive activity. I mean, massive activity that can reach people in a massive scale. The first thing, I was personally involved into interventions, and I'm going to do it as quick as possible. The first one is an intervention that is a very innovative approach. We actually launched, myself and another doctor, which happens to be not an Adventist doctor, but is also doing medicine. Is doing medicine in preventive medicine. We launched what we call health movement, a social movement around health. We call that MSA. This is a French word. This is even a Creole word. But the idea was to launch a social movement, calling people and challenging them to actually implement changes in 5 areas of their life: optimal diet, physical exercise, stress management, vitamin D supplement, and rest. And we were surprised to see that the answer was very positive, and we have hundreds of people already subscribing to this movement, and they are ready actually to take the challenge and to actually doing the next 8 to 12 weeks. They will follow us in knowing what they will need, and it is becoming very successful. The second intervention we are part of is an intervention that we are implementing with ADRA, and to some extent the hospital is involved in that as well. This is on behalf actually of the Ministry of Health and UNICEF that is co-sponsoring this second intervention, is to actually enhance. I mean, we develop a project to enhance the overall resiliency of school children and church members in front of COVID. In both interventions, mental health is a key intervention that we are going to do. And what we try to do is to implement activities using new technology, using the social networks, using the telephone, and trying to reach people as far as they can be. And by the end of these 2 interventions, we are hoping to reach over 5,000 people directly, person to person, by providing coaching and mental health support, among other interventions. And I'm taking the opportunity of this to actually raise a call and say that the only thing that is missing in this intervention is support. If anybody is willing to support this, you can contact the Adventist Hospital, and I will manage with my colleagues to figure out how we can benefit from this, because the infrastructure are very poor. There are not too many resources, including human resources, but we launched these things, and they seems to be very successful so far.
Thank you. Thank you so much, Dr. Dinas. And I just want to make sure our viewers are following what we are talking about. We have talked about the physical effects of COVID. We talked about the secondary effects of COVID, and one of those being the mental health. Again, Seventh-day Adventists believe in physical, mental, emotional, and spiritual healing. And that is why we are so excited about what you are doing and what many other locations, we talked about Weimar, bringing out the health, the mental health of our people. Well, we want to come back to Dr. Nedley. Dr. Nedley, again, we have a question for you in regard to lifestyle. Let's go ahead and bring Dr. Nedley out. That would be great. You can, thank you so much. Dr. Nedley, you know, we heard about the effects of lifestyle. Can you tell us some scientific etiology, just very briefly? I know we don't have much time, but as far as how we could use different lifestyle principles to optimize our immunity, regardless of whether we're in Haiti or another location or here in the United States. And I believe you may be muted, sir. I still can't hear you. We're not sure. We're having trouble with Dr. Nedley's mic. Let's go to the next presenter and we'll come back to Dr. Nedley. So let's bring back Dr. Milton Mesa. Dr. Mesa, we've talked about, again, the holistic approach to health, physical, mental, emotional, and we want to get to the spiritual aspect. I know you talked about your students utilizing these principles of lifestyle medicine and getting to the real root of the issue. How are we telling people of God's great message of mercy? You know, sometimes we refer to that in Revelation 14, but how are we utilizing this in this current COVID-19 crisis?
Well, Dr. Lela, having the opportunity of reaching to people, even if it is virtually, as we said, in their homes, linking with the health system, linking with the public health system, sometimes in our own hospitals, and our students being a part of that, we have the opportunity to let people realize that we are creatures from God. And that's part of the three angels message that we have as a church.
Right.
The first message actually highlights the true worship to God as a creator. And as we link a healthy lifestyle, that is the map that God provided us to be healthy, to enjoy life, we can link that with the concept of a God that is ready to end the story of this world as we know it now, to bring it back to what it originally He planned for us as human beings. So the concept of worshiping God and going away from humanly made gods, you know, when we put other things in front of God, that's part of the second message. And then developing an identity that is clear and is linked with our Creator, that is part of the third message, that we can share as part of the health message. It's actually linked. It can be separated. We have a wonderful opportunity as people look for certainty in a world that can't provide it now. And that doesn't mean that we need to go away from the evidence based good practices that we can have as physicians and in our lifestyles. It means that we can provide hope linking those things with the purpose why we have them, that is to enjoy life in the way that God dreamt it for us and to prepare to live in eternity with Him.
Amen, Dr. Mesa. Amen. You know, we have been counseled that the message of health is kind of like a way to open a door to bring this beautiful message of mercy, this Revelation 14 message of mercy to a world that is dying, not just physically, but most importantly, spiritually. So thank you so much for what you and your team and your students are doing there in Argentina. Well, we want to come back to Dr. Nedley now at this time. Let's bring Dr. Nedley back up. Dr. Nedley, in regard to what Dr. Mesa was just talking about, and he was mentioning some of the principles, even getting to Revelation 14, can you tell us about the Edenic diet just a little bit and why perhaps that might play a role in benefiting us even in this COVID-19 pandemic the globe is facing?
Well, the original diet was a plant-based diet, you know, fruits, vegetables, grains, seeds, nuts. And this is a high antioxidant diet, and it can help us prevent as well as treat a number of diseases, including COVID. And it also helps us to keep the obesity rates down. The acronym I utilize when I go around and speak about COVID is COVID itself. The C, of course, is the preventive measures, which most of the world has been centering in on. Not much of the world has been centering on in the O part, but we've talked about it here, obesity. This is a major contributor. In fact, we could almost call the obesity the cause of death and COVID a secondary cause, with what's been happening around the world when we look at BMI. And of course, obesity can cause a whole host of other diseases. The V stands for vitamin status, and our vitamin status is going to be much better, not only with diet and an Edenic diet, but also with vitamin D, which is sunlight exposure. Or if we're low in it, we're even finding in treatment centers that when we give even IV vitamin D, if someone has COVID, their risk of being going on to death or a ventilator goes down significantly. And so even vitamin C, which is found in raw fruits and vegetables, seems to have a role to play. The I that increases our risk as well is insomnia. And if we are too worried about COVID and we're on screens always trying to keep updated regarding COVID, we're actually going to be much more at risk when we eventually get COVID. And, you know, one of the things we need to keep in mind, some experts are saying within 5 years, 70 to 80% of us will get this. And so if we are obese, don't panic about it. Work on getting it under control. If we aren't getting sunlight exposure, let's get that. We may not get this for another 4 years personally, but we can be preparing now for having our body in tip-top shape where COVID just becomes a little cold. And then the final D is depression. Depression does suppress our immune system. And as we talked about, depression and anxiety rates are skyrocketing, not only due to COVID, but our response to COVID. And so it's very imperative that we do what is necessary to improve our mental health. And that's why I'd like to have a lot of people be aware of the online resources as well as the physical resources, many of them simple measures that can improve our mental health and improve our immune system and make COVID a non-event if and when we get it.
Wow, thank you so much, Dr. Nedley. And I just want to bring out one more time what between you and what Dr. Milton was saying, that these beautiful principles of lifestyle are there to provide us, again, as Seventh-day Adventists, to give God's message of mercy to a world that is depressed and anxious and having insomnia. So what a beautiful time globally that we can take a pandemic. Satan meant it for evil, but God could possibly use it, of course, for good. Thank you so much, Dr. Nedley. Thank you for what you are doing there at Weimar. Well, now we are very excited to have our second medical presentation. I am thrilled to introduce Dr. Dorival Duarte. Dr. Duarte is an infectious disease specialist at the School of Medicine at Universidad de Montemorelos. He is also the founding partner and member of the board of directors of the Association of Adventist Doctors in Brazil. Dr. Duarte, I've been very impressed in following you, and I'm looking forward tremendously to your presentation that we have for us tonight. Thank you so much, sir.
Thank you, Lela. And first of all, I would like to ask you, be patient with my English, okay?
It's perfect. It's perfect.
Well, we have great challenges that are before us individually, ecclesiastically, and especially medically. Individually, because the life routines of almost everyone, if not all of us, have been dramatically changed to face this new invisible enemy. Our daily activities, our way of working, studying, relating to family, friends, and acquaintances, all changed radically, and we had to adapt to them. Ecclesiastically, because we had to get used to a new routine to community worship services, which fortunately made us discover through electronic and internet tools new ways to exercise a positive influence on the lives of the people with whom we interact. Medically, we have the challenge because many of us, as medical professionals, and so many others, directly or indirectly, make up the right arm of the gospel message. As Mrs. Ellen White reminded us, I have some slides. I don't know if you can give me the slides, because from here I cannot pass the slide for myself. But Mrs. Ellen White, she wrote, "The medical missionary work is the right hand and arm of the third angel messages, which must be proclaimed to a fallen world. And physicians, managers, and workers in any line, in acting faithfully their part, are doing the work of the message." Next slide, please. Next slide, please. And next slide, too. When the first case of COVID-19 became known, it seemed for many of us in the West that at most it could be behaved as in a more localized or less disseminated way as the behavior of SARS in 2002 or MERS were in 2011. However, when we saw the dramatic scenes of some hospitals in Hubei province, concerns for us in the Western world increased. As much more when from January 31, the first case identified in Italy started to multiply almost in the geometrical proportion, and on March 20, Italy had become the country with the highest number of confirmed coronavirus deaths in the world. The scenes of the overcrowded Italian hospitals, and especially the tragic scenes of the Italian army taking the coffins of dozens and dozens of people to be incinerated outside the city of Bergamo in Lombardy for lack of space in the local cemeteries, made an impression that will never be forgotten by the eyes of those who saw it. When looking at what happened in China, then in Italy and in Spain and in other countries, we wondered that it would be like here in Brazil when the pandemic hit us hard, especially when it reached the poorest segments of society. In Brazil, this segment lives in which we call favelas, or slums in English, as you can see in the next slide. As in other parts of the world, field hospitals, some of them you can see right now, were built to improve it, or were built or improvised on an emergency base to meet the high demand that has knocked at our doors. Convention centers and stadiums, such as Maracanã Stadium, perhaps the best known football stadium. It was where Brazil in 1950 lost the grand final of the World Cup to Uruguay. They were transformed into a hospital. Short before that, in the United States, the first case of COVID-19 was diagnosed in January 20. The first patient with COVID-19 in Latin America was diagnosed in São Paulo on February 26. And since then, we have been experiencing the anxious and undesirable expectation of waiting for the first case in our own hospital. We had to change the whole dynamic of the hospital care, suspend surgery and elective hospitalizations, create service flows, create and increase the number of beds in ICUs, transform surgical centers into potential ICUs. It was necessary to increase the provision of personal protective equipment. All this was surrounded by the high inflation and the cost of supplies and medicine, which in Brazil, for example, made the price of a box of procedure gloves in a matter of a few days start to cost 10 times more. Due to the high demand for hospitalizations and the growing number of patients who started to be hospitalized, requiring medical attention in intensive care units, we had the risk of the absence of sedatives and neuromuscular blockers, which are essential drugs in the management of patients with mechanical ventilation. New ways of managing critical patients had to be created or improved. As you can see in this photo, the prone position that was unusual in our ICUs before COVID-19. In all hospitals, we had to isolate patients, and in doing so, separate families by prohibiting face-to-face visits, in many cases depriving the patients of dying without personnel seeing any of his loved ones, and without feeling the presence and affection of those he loved most. These situations, in addition to the profound and undescribable impact of the response of the relatives of patients who died, also have permanent marks on the memory of doctors and nurses, physiotherapists, and other members of the health team. Currently, the number of cases in the world is getting close to 23 million, with the first three countries being the United States, Brazil, and India, followed by Russia. However, when we look at the number of deaths, about 800,000, the United States and Brazil are the two main countries with the highest number of deaths, followed by Mexico and India. It is noteworthy that Mexico, even though it is the seventh country in number of diagnosed cases, it is the third in number of deaths, in clear description of what can be verified in India, which, despite having a number of 5 times greater than cases, it has a smaller number of deaths than that we can evidence in Mexico. This factor can probably be explained by the prevalence of non-communicable diseases such as diabetes, obesity, and hypertension, which are categorized as having a worse prognostic risk when infected with COVID-19. Cumulatively, today, India is the country with the highest number of infected patients per day. Briefly, among others, I will mention just three of some of the main impacts of the pandemic in Latin America: economy, education, and mental health. In economy, the coronavirus pandemic will cause a historic 2.3% drop in the economy of Latin America and in the Caribbean in 2020, which will lead to the region's worst social crisis in decades, with millions of new poor and unemployed, according to the Commission Economy for Latin America and the Caribbean. Last December, the Economic Commission for Latin America and the Caribbean had estimated that the regional economy will grow 1.3% this year. Though amid a general slowdown already, now it is predicted that virtually in all Latin America, economies will shrink. This regional decline will leave almost 30 million of people in poorer conditions and increased levels of extreme poverty. And unemployment rates is expected to be around 11.5%, an increase of 3.5% compared to the 2019 level, which represents almost 40 million people. In education, more than 95% of children are out of school in Latin America and in the Caribbean, estimates UNICEF. Even when closure schools is temporary, it has high social and economic costs. These disruptions affect people in all societies, but the impact is more severe for children in situations of social and economical disadvantage, and their families, including a disruption in learning, stress, and anxiety, impacts on the nutrition of students who depends on free food programs, as well as decreased economic productivity, as owners and families are asked to isolate themselves. Working parents are more likely to miss work when schools close in order to take care of their children, incurring wage penalties in many countries, which negatively affects productivity. For Bernd Assing of UNICEF, the regional director for Latin America and the Caribbean, this is an educational crisis unprecedented in the recent history of Latin America and the Caribbean. He said, "There have never been so many schools closed at the same time. If schools closures are prolonged, there is an great risk that children and adolescents will be delayed in their learning, and we fear that the most vulnerable students will never return to schools' classrooms. It is vital that they do not stop learning at home." In a study a few days ago published by the government of São Paulo that investigate the prevalence of SARS-CoV-2 infection in primary and secondary school students in the same city, it showed that 16% of students had been infected by SARS-CoV-2 and 65% of them were asymptomatic. This fact called the attention of the risk that this group could become silent spreaders of the virus at school, in their families, and in the community as well, since 25% of the students lived with relatives over 60 years of age. This caused the mayor of the city of São Paulo to postpone the reopening of schools until October, which had been previously scheduled for September. It is a common concern that schools may not be able to open for class again this school year here in Brazil. In mental health, in the context of mental health, there is an impact in many that may never be quantified. Fear of an invisible and lethal enemy intensifies the levels of stress and anxiety in healthy people and increase the symptoms in those with pre-existing mental disorders. Patients diagnosed with COVID-19 or suspect of infection may experience intense emotional and behavioral reactions, in addition to guilt, fear, melancholy, anger, loneliness, anxiety, insomnia, etc. These states can develop into disorders such as panic attacks, post-traumatic stress disorders, psychotic symptoms, depression, and suicide. As the transmission of the virus can easily occur through personal contact, family members are commonly separated from their relatives diagnosed with COVID-19 in order to avoid contagion. However, in more severe cases of the disease, when that occurs, it is observed that the individual may manifest feelings of incapacity and frustration for not being able to be present in the final hours of life of his or her loved one. How can we, as Adventist health institutions or Adventist health professionals, or even simply as member of the remnant church born from the prophecy of Daniel 8:14, how can we contribute to alleviate the suffering caused to our fellow men by this potential lethal virus? In your country, in your continent, consider all possibilities, ways to manifest to your fellow men and women the wonderful love of Jesus, the doctor of doctors. In my country, Brazil, there are 5 Adventist hospitals. 4 of them were and are still in intense activity receiving patients with COVID-19. We received important support from Adventist psychologists who mobilized to offer free online psychological care for healthcare professionals in Adventist hospitals in South America. And not only for them, but to their families as well. This made a big difference. In the city of São Paulo, there is the São Paulo Adventist Hospital. That is the first hospital Adventist in Brazil. As we serve patients of a health plan that in the city of São Paulo alone has around 450,000 members over 60 years of age, out of 487 hospitalized patients, our mortality rates was 17%. Of our 800 employees, 30% become infected with no deaths. In north of Brazil, in the cities of Manaus and Belém, in the Amazon region, there are 2 important hospitals Adventists for South America. In these 2 cities, the epidemic reached its peak extremely quickly, leading to a collapse in the local health system with a disproportionate amount of death. The Manaus Adventist Hospital that you can see in the picture, a 105-bed hospital reached 88% of its beds occupied only with patients with COVID-19. You can see the hospital on the next slide. Even so, the hospital continued to share the message of hope with the study of the sacred scriptures, with non-Adventist doctors, and spiritual support for employees, patients, and their families, as you can see in the next photos. Belém Adventist Hospital. Belém Adventist Hospital, one of the largest hospitals in the northern of Brazil, and the first hospital in the northern Brazil to perform a heart transplant, had more than 500 hospitalizations confirmed by COVID-19. 190 employees become infected, as well as 23 doctors, 3 of them who died. One of the colleagues who had been the director of the South America Division's health department, who had been critically ill under mechanical ventilation, fortunately recovered. The essence of the good technical care involved in Jesus' tender love can be seen in the discharge of 102-year-old patient who recovered from COVID-19. The Silvestre Adventist Hospital, the next hospital that you can see in the next slide, the Silvestre Adventist Hospital is located near to the statue of Christ the Redeemer, one of the 7 wonders of the modern world. In 2007, it's happened this year, it is the hospital that performs more liver transplants in Brazil. They admitted almost 200 patients with COVID-19, 173 employees, of which 132 health professionals become infected, and an intensive care physician died in the same ICU where he had worked for 40 years, many of which were spent as the head of that same ICU. Even so, during the pandemic, the hospital continued its spiritual, social, and healthcare emphasis based on the example of Jesus Christ. Finally, when I look back 1992, when I was still a young infectologist, looking at that year's papers and scientific articles on the spread of multidrug-resistant tuberculosis strain, which in HIV-positive patients in North American prisons experience
Doctor, please, your microphone is muted. If you could unmute it, it would be very helpful. Thank you.
Okay, thank you. Mrs. White, on the great controversy between good and evil experienced in the universe, and which we can see extending to the microscopic world of microorganisms when faced with simple and complex infections, she said, while referring to Satan, she said, while appearing to the children of men as a great physician who can heal at their maladies, he will bring diseases and disaster until populous cities are reduced to ruin and desolation. Even now, he is at work in accidents, in calamities by sea and by land, in great conflagrations, in fierce tornadoes, in terrific high storms, in tempests, floods, cyclones, tidal waves, and earthquakes, in every place, in 1,000 forms. Satan is exercising his power. He sweeps away the ripening harvest, and famine and distress follows. He imparts to the air a deadly stench, and thousands perish by the same pestilence. These visitations are to become more and more frequent and disastrous. May the Lord continue to guide us in the future that lies before us.
Thank you so much, Dr. Duarte. Thank you for taking a time to demonstrate the second leading country in the world with COVID-19 being Brazil. Thank you so much. We really appreciate it, and leaving us with a spiritual emphasis as well. Well, with that, we want to quickly welcome and introduce Dr. Eli Henry. He's the president of the Inter-American Division. He's going to give us our division thought. Thank you, Dr. Henry, for joining us so much. We appreciate it.
Thank you, Dr. Lela. Thank you very much. Good evening, everyone. We cannot say enough, and it is very well recognized that in all latitude, continents, islands, and countries, we are living in a special time. A small virus came and put us on the edge, transforming many concepts and way of life. Now we are talking about a new normal. Coronavirus came and our life is no longer the same. The COVID-19 pandemic forces us to think out of the box, although at the same time, it moves us to recluse ourselves with the best practice: stay at home, keep the distance. But we have to think on what is the purpose of our lives, or institution, or beliefs. What to expect next, what God is expecting from us. And I want to join my voice to thank the organizer of this Global Summit on Adventist COVID-19 for this initiative, also AWR, where we come with a joint effort to go to our community and to be the voice of God, and also to be his hand. 2 or 3 weeks ago, we had a meeting with the leadership of the church in one of the 34 countries of the Inter-American Division. And when I'm talking about Inter-American Division, I refer to the countries of Mexico, Central America, the northern part of South America, Colombia, Venezuela, for instance, and all the islands in the Caribbean. The COVID-19 is very much alive, and you heard a different presentation about this aspect in our region. The invitee in that meeting was a prominent professor, a specialist, who has been giving advice to governments, universities, school of medicine, private sector about the way forward the pandemic, having himself dealt when he was in government with another one in the past, the H1N1. He considered that he is himself a friend of the Seventh-day Adventist Church. But it was amazing to hear him talking, referring to Madam White, is the way he talked, Madam White, as one of the most relevant writers who has a pertinent message for today. And the doctor is very much familiar with the writing of Ellen White and knows and appreciates the Seventh-day Adventist Church. And his message to us was, you have something special. You have to leave your cloud, your pulpit, your churches, and go to the community and give that message, who is so holistic of well-being, and teach the people in living testimony all the benefits of taking care of your health. That was something extraordinary for me, to hear someone, a professor, talking like that. And he quote Ellen White, saying in Temperance, page 9, he says, our Heavenly Father sees the deplorable condition of men, who many of them ignorantly are disregarding the principle of hygiene. And it is in love and pity to the race that it caused the light to shine upon health reform. He publishes his law and his penalties in order that all may learn what it is for the highest good. And he gave them all those possibilities. It was wonderful quotation of Ellen White saying that what we have come from God. God is so amazing, God, and he wants our well-being. He wants us to be healthy, and not for us only, but to say it to others. My message tonight to you is what we are doing. Let us continue to do it to the open, out of the box, out of our temple. We don't have temple anymore. Now, regularly meeting. We have to go to the community. We cannot really talk to the community in big gathering, but let us spread the word by example, living the message of we have hope and health. God bless you in the work you are doing, and let us continue saying to all our friends, I pray that you may enjoy good health, and that all may go well with you, even as your soul is getting along well. Blessing to all of you.
Thank you, Pastor Henry. What a wonderful, beautiful message. And it reminds me, you know, Ellen White said she saw in vision people running from homes to homes. Who knows? Perhaps this is the time that we should begin to delve into these things and take these lifestyle principles that we know that God has given us and teach those around us. Well, I am very excited to hear our final remarks from Pastor Mark Finley. Pastor Mark Finley is my mentor personally. I absolutely enjoy every week spending with him on Level Up, and I'm looking forward, Pastor Mark, to your words of wisdom and presentation, final words for us tonight. Thank you so much.
Well, Jesus longs for us to live lives of wholeness and abundance. In John 10, verse 10, the Bible says, the thief cometh not but for to steal and kill, but to destroy. It's the devil's intent to destroy our health, but God has given in Scripture and to the Seventh-day Adventist Church a message of wholeness and health to restore men and women to the image of God, both physically and mentally, emotionally, and spiritually. Recently, I read a story that impressed me very, very much. It was an ancient legend. A farmer on a horse-drawn wagon was driving down a dirt road on his way to Old Constantinople, now known as Istanbul in Turkey. And as he was driving, he saw a peasant woman with a hood over her head and a grim-looking evil face walking down the road beside him. He stopped and asked the woman if she wanted a ride, asked where she was going, and she said, to Istanbul, Constantinople. He said, what's your name? Pandemic. You are Pandemic? Yeah, I'm Pandemic. Cholera by name. Where are you going? I'm going to inflict the people in Constantinople with cholera. This man then said, look, I'm not going to take you. If you're going to inflict people with cholera, I'm not taking you. And they argued back and forth. And finally, they agreed that she would kill only 5 people with cholera. And she gave him, according to this legend, of course, a magic knife that If she killed more than 5 people, he could take that knife and he could kill her. And so after he dropped her off, days went by and hundreds died. And he met the woman again and he said, "You told me that the death sentence would be upon you if you killed more than 5 people, but hundreds died." And she looked up with a grim look on her face and said, "No, cholera killed 5, but worry, fear, and anxiety and grief killed the rest." Now, I know that's a fictitious story, but I think it has a major role to play. I'm interested in a statement in this book, Ministry of Healing. It says this: it's a wonderful book. If you do not have it, let us know and we'll see what we can do to get you a copy. But in Ministry of Healing, a book written in the 19th century about health, it says, grief, anxiety, discontent, remorse, guilt, distrust all tend to break down life forces and to invite decay and death. As serious as COVID-19 is, one of the residual effects is creating such grief and anxiety, such distrust, that what does it mean when it says the life forces are broken down and they invite decay and death? In other words, it ruins your immune system. So what's the ultimate answer to that? As we work on the physical aspects of COVID-19 and attempt to build our immune systems by eating a healthy diet, getting adequate rest and exercise, and as we work on the emotional aspects, trying to have, in this time of quote unquote social distancing, trying to develop relationships where we call people on the phone and support one another, or in our neighborhoods, put our chairs 6 or 8 feet apart out on the patios or driveways, and interface and communicate as we email people and write letters and try to have this friendship emotion. What about the spiritual aspects of our lives? How can we be free from worry that cripples us? Worry is an emotion. We can't stop emotions from developing, but we can stop them from having a crippling, paralyzing effect. There is a marvelous text in Scripture in 1 Peter 5, verse 7 that says this: casting all your care upon him, for he cares for you. That word care means stress, anxiety. It's what's tearing you apart at the seams. Is it some financial burden because of COVID-19? Is it having the children at home that are causing stress? Has COVID-19 caused greater marriage problems? What has it done to your life? Casting all your care, all your stresses, all your anxieties. You see that word casting? It's an interesting word. The New Testament is written in Greek. It's a very fascinating word. That word casting is a word of boats, a word of sailors. It's the idea of casting the anchor overboard. When you cast the anchor overboard, why do you do that? The anchor digs deep and it solidifies the ship. It stabilizes it in a time of storm. So Jesus says, cast your care upon me. I will stabilize you. I'll keep you steady. I'll keep the waves of life, the troubles and trials of life overwhelming you, casting all your care, all your anxieties upon him. Why? Because he cares for you. The God that created the universe, the God that hung the stars in space, the God that created sun, moon, and stars, the God that carpeted earth with living green and caused every tree to blossom and every flower to grow, the God that created the animals and created human life, that God cares for you. And he invites you tonight as we pray to cast all your anxiety, all your care upon him. His shoulders are big enough to bear the weight of your burden. His heart is large enough to absorb your worries and anxieties. His care for you is infinite. Let's pray. Father in heaven, we thank you with all of our hearts that you've not forgotten us in this pandemic of COVID-19, that you've not left us alone at this time of difficulty financially and marriage problems and sickness, that you're there by our side to strengthen, to support, to encourage. So tonight we cast our care, our worries, our anxieties upon Jesus. Take them, my Lord, and give us peace, we pray in Christ's name. Amen.
Dr. Mark. Thank you so much. You know, you are an international speaker, author, special assistant to the president of the General Conference of Seventh-day Adventists, and we appreciate you taking the time out of your enormously busy schedule to give us words of wisdom and advice. So again, thank you so much for everything that you do and bringing the holistic aspect of health. You mentioned a book, Ministry of Healing, and we do have copies for those of you who are interested. If you would like to write in awr.org/gift, and we will do our best to get you a copy. Again, thank you to all of you for joining us. This is the conclusion of the first of 4 series part Adventist COVID-19 Global Summit. If you have not yet registered for the next 3 sessions, we ask you to please do so. Please go to awr.org/health and please register right now. On your screen, what you're seeing is the website for the book Ministry of Healing, awr.org/thank you. But we also want you to register for the symposium at awr.org/health. Until next time, God bless you and keep you in good health, holistically, physically, mentally, emotionally, and spiritually. God bless.